much, everybody. Thank you. Thank you. Thank you so much. Everybody, please, have a seat. Thank you so much, Travis, for the wonderful introduction. Thank you for Melody Barnes, who has done more than anyone to help coordinate this forum, and it's extraordinary work, and so we appreciate her leadership. You know, we're here today to discuss one of the greatest threats, not just to the well-being of our families and the prosperity of our businesses, but to the very foundation of our economy, and that's the exploding costs of health care in America today. In the last 8 years, premiums have grown 4 times faster than wages. An additional 9 million Americans have joined the ranks of the uninsured. The cost of health care now causes a bankruptcy in America every 30 seconds. By the end of the year, it could cause 1.5 million Americans to lose their homes. Even for folks who are weathering this economic storm and have health care right now, all it takes is one stroke of bad luck, an accident or an illness, a divorce, a lost job, to become one of the nearly 46 million uninsured, or the millions who have health care but really can't afford what they've got. We didn't get here by accident. The problems we face today are a direct consequence of actions that we failed to take yesterday. Since Teddy Roosevelt first called for reform nearly a century ago, we have talked and we have tinkered. We have tried and fallen short. We've stalled for time. And again, we have failed to act because of Washington politics or industry lobbying. And today there are those who say we should defer health care reform once again, that at a time of economic crisis we simply can't afford to fix our health care system as well. Well, let me be clear. The same soaring costs that are straining families' budgets are sinking our businesses and eating up our government's budget too. Too many small businesses can't insure their employees. Major American corporations are struggling to compete with their foreign counterparts. And companies of all sizes are shipping their jobs overseas or shutting their doors for good. Medicare costs are consuming our federal budget. I don't have to tell members of Congress this. Medicaid is overwhelming our state budgets. I don't need to tell governors and state legislatures that. At the fiscal summit that we held here last week, the one thing on which everyone agreed was that the greatest threat to America's fiscal health is not Social Security, though that's a significant challenge. It's not the investments that we've made to rescue our economy during this crisis. By a wide margin, the biggest threat to our nation's balance sheet is the skyrocketing cost of health care. It's not even close. That's why we cannot delay this discussion any longer. We asked concerned citizens like the folks on this stage to organize open meetings across America where people could air their views. As Travis said, more than 3,000 meetings were held in all 50 states and D.C. More than 30,000 people attended. I thank them for their input and their ideas and look forward to reading the report that Travis presented to me. In this effort, every voice has to be heard. Every idea must be considered. Every option must be on the table. There should be no sacred cows. Each of us must accept that none of us will get everything that we want, and that no proposal for reform will be perfect. If that's the measure, we will never get anything done. But when it comes to addressing our health care challenge, we can no longer let the perfect be the enemy of the essential. And I don't think anybody would argue that we are on a sustainable path when it comes to health care. Finally, I want to be very clear at the outset that while everybody has the right to take part in this discussion, nobody has the right to take it over and dominate. The status quo is the one option that's not on the table, and those who seek to block any reform at all, any reform at any costs, will not prevail this time around. So I didn't come here to Washington to work for those interests. I came here to work for the American people. They are why we're here today, to start delivering the change they demanded at the polls in November, that they have continued to demand since the election. And if we're successful, if we can pass comprehensive reform, these folks will see their costs come down, they'll get the care they need, and will help our businesses create jobs again so our economy can grow. So it's not going to be easy, and there are going to be false starts and setbacks and mistakes along the way. But I'm confident if we come together and work together, we will finally achieve what generations of Americans have fought for and fulfill the promise of health care in our time. And what a remarkable achievement that would be. Something that Democrats and Republicans, business and labor, consumer groups and providers, all of us could share extraordinary pride in finally dealing with something that has been vexing us for so long. So, let's get to work. Thank you.